Welcome back to our continuing series on the topic of dental assisting for the non-professional volunteer dental assistant. In this video, we will be explaining the fundamentals of instrument transfer between the dentist and his or her dental assistant. The purpose of this practice is to enable the dentist to use a variety of dental instruments in an orderly fashion, and most importantly, to allow the dentist to concentrate his or her focus on the work in progress. In this way, the dentist can complete the required tasks in a timely fashion, thus maximizing his or her clinic time while meeting the patient's needs most efficiently. For this aspect of dental practice to be successful, it is necessary for both the dentist and the dental assistant to be familiar with the clinical procedures, and the dental assistant is sufficiently familiar to anticipate the dentist's next need, being prepared to provide whatever is next, whether it be an instrument, a medication, rinsing or drying the teeth. As a volunteer new to clinical dentistry, these skills will come, but they will take time to master. So be diligent in your attempts to learn the requirements of a competent dental assistant, but at the same time be patient with yourself. Dentistry is a complicated profession, and it takes time to master. In these images, you can see the basic difference between how a dentist will hold the instrument and how a dental assistant will hold the instrument. Be mindful of the way that you hold the instrument will facilitate the doctor being able to grasp the instrument properly and be able to use it. Be careful, do not hold the instrument in the middle, as this will leave the doctor with no place to grasp hold of the instrument for use. As you can see in these images, the dental assistant is holding the instrument in the middle, and the doctor is not able to grab hold of the instrument properly. When the doctor requires a new instrument, he or she will give a signal by a subtle movement of the instrument away from the palm of the hand. This will tell the assistant that it's time to transfer the instrument that they are holding for the one that the doctor is holding. In these images, notice how the doctor's hand, which is in lavender, and the assistant's hand, which is in purple, effectively transfer the instrument. How the assistant will extend her little finger, grasp the doctor's instrument from underneath, and then deposit the instrument that they are holding, which they are holding by their thumb and forefinger, into the hand of the doctor. There's a variety of angles here, so notice how the instruments are transferred. In these images, notice how the assistant is able to grasp hold of the explorer and at the same time be able to effectively pass the composite dispensing gun in a very efficient manner by holding the working end, giving the handle of the instrument to the doctor. In the next several clips, you're going to see a variety of instruments being transferred from several different angles. Notice as you look that the techniques will remain essentially the same no matter what we're passing, whether it be an instrument or a syringe, etchant syringe, or a little brush. It doesn't really matter. Remember, the key feature though is that You transfer from the little finger to pick up an instrument. You pass onto the forefinger of the doctor. Make sure that the middle part of the instrument going to the doctor is free so that they can grasp it. With this, you should be able to have a good transfer, and you and your doctor should be able to work very smoothly together. One of the things that we're going to do right now, my assistant Q and I will be demonstrating to you the general principles of four-handed dentistry, but the specifics will be defined to you by the doctor that you work with. In this initial transfer of the Mirror and Explorer, notice how both instruments are transferred together. Any instrument. Okay. Now. Partnership is. Okay. Now,
Excellent.
as the doctor and the dental assistant are working together to provide restorative care, otherwise doing fillings, one of the things that is important is for both for the doctor and the assistant to understand their individual roles and how their roles will complement one another. How the assistant's major role is to provide the instruments and to provide the support so the doctor can remain working to provide the care to finish the case as quickly as possible. Speed is not the issue, not the point, but efficiency is. So everything that we do, both doctor and assistant, is designed to enhance efficiency between the doctor and the assistant to provide care in the most timely manner. In this next segment, my assistant and I are going to be doing a simulated restorative procedure, a composite restoration. We will be highlighting each of the steps, but as you watch, notice for the transfer, because as you work as a dental assistant, you too will be providing this kind of assistance for your doctor. Okay. Give this to you. A little water. Okay, we're going to cut the prep, rinse please. Now, if you would, stay in certain section. Okay, good. Drying the face. Green gel. Suction. Check occlusion. Tap, tap, tap. Buzz. Drag. Check it out.
Tap, tap, tap. Open.
Buzz. Drag. Check it out.
Tap, tap, tap. Open.
Final rinse. Now, as you can see, we were able to work in a very effective manner because each hand had a job to do and each hand was able to do it. How did we come to this? Basically, we did a lot of cases. As you and your doctors that you work with do more and more cases, you will become more proficient. And as you become more proficient, your confidence will increase. And then you and your doctor will find yourself working very effectively. The responsibility, though, that you may have right now is to come to understand the names of the instruments and the form of the procedure as you go from the first step through the last step, that you should be able to understand what those steps are and what your role in fulfilling each step is, so that we can finish the case, that you can and your doctor can finish the case as efficiently as possible.